Hello and welcome back to Money Never Sleeps. My name is Bob Cruces from M&A Wealth. If you'd like more information about what you hear during the show, give us a call at 866-973-3627 or visit us online at mnawealth.com. And while at my website, click on the page to check out past shows and subscribe on Apple Podcasts or Spotify. Today, we're talking about a topic that will impact nearly every retiree in one way or another: Medicare changes for 2026. Especially the rise in Medicare Part B premiums. These changes touch on Social Security, out-of-pocket medical costs, prescription expenses, plan selection, and more. Understanding how each component fits together can help you better prepare your financial strategy for the year ahead. According to a USA Today article, it's official. Medicare Part B 2026 premium will eat a big chunk of Social Security. COLA has some excellent details. Medicare costs will eat up a significant portion of older Americans' Social Security cost of living adjustment next year. The standard monthly premium for Medicare Part B, which covers outpatient care, doctor's services, durable medical equipment, and preventive care, will rise to $202.90 in 2026. That's an increase of $17.90, or almost 9.7% compared with 2025. Now, while that increase is smaller than the $21.50 projected earlier by the Medicare trustees, it's still the second largest dollar jump in program history, and it's more than triple the 2.8% Social Security cost of living adjustment, COLA, retirees will receive next year. In practical terms, this means many seniors will see their standard of living pressured once again by rising healthcare costs. Let's put those numbers into perspective. According to the Social Security Administration, the average monthly Social Security benefit will increase by $56 in January because of the COLA. But once the $17.90 Part B increase is deducted, most retirees will effectively see just $38.10 more in their monthly checks. For someone on a fixed income, $38 is not a meaningful raise. It's grocery money, medication money, or gas money. It's not extra spending, it's survival spending. This squeeze is happening at a time when seniors are already vulnerable. Older Americans were the only age group that saw an increase in poverty in 2024. Every other age group either remained stable or improved. So, the significance of these rising Medicare costs cannot be overstated. To understand how Medicare interacts with Social Security benefits, we need to talk about the hold harmless provision, a rule that can prevent certain beneficiaries from having their entire COLA wiped out. With such a large Part B increase coming, the rule will likely kick in for individuals receiving $640 a month or less in Social Security benefits. Here's how it works. The hold harmless provision prevents the Part B premium increase from being larger than a person's COLA. If the premium rises more than their Social Security benefit increases, the beneficiary doesn't have to pay the full premium hike. Instead, the unpaid portion gets spread across other Medicare enrollees who aren't protected by the rule. For someone receiving $640 a month, their 2.8% COLA amounts to just under $18. Without hold harmless, the $17.90 premium increase would have completely wiped out their Social Security increase for the year. With hold harmless in place, that individual will keep at least a small portion of their COLA. It's interesting to look at how this rule varies year to year. In 2022, only about 1.5% of beneficiaries needed hold harmless protection. Part B rose by $21.60, but Social Security increased by $92, so most people could afford a higher premium. But in 2017, the situation was dramatically different. Premiums rose by 10%, while the COLA was only 0.3% or around $5. Because of this imbalance, about 70% of enrollees paid a lower than standard Part B premium under the hold harmless rule. However, hold harmless is not a cure-all. Even if someone is protected from the full Part B increase, other costs can still reduce their net Social Security benefit. Many retirees have premiums for Medicare Advantage or Part D prescription drug plans deducted directly from their Social Security checks, and some of those plans are raising premiums significantly in 2026. In fact, certain Part D plans will increase premiums by as much as $50, which is the maximum allowed under the Part D Premium Stabilization Demonstration Program. At the same time, the number of standalone Part D plans available has been cut in half since 2024, which reduces flexibility and affordability for many seniors. Another cost to be aware of is the Medicare Part B deductible. Before Medicare begins paying its share of outpatient costs, beneficiaries must meet an annual deductible, and that amount is also rising. In 2026, the deductible will be $283, up $26 from the 2025 level of $250. When you put this together with the premium increases, retirees will be facing higher costs on several fronts. Now here's an interesting twist. Medicare Part B premiums could have been even higher. According to CMS, earlier policy changes succeeded in reducing spending on skin substitutes, which are biologic or synthetic materials used to treat chronic wounds like diabetic foot ulcers. Without those changes, the premium increase would have been about $11 more per month. CMS finalized reimbursement reforms in the 2026 physician fee schedule, and these changes are expected to lower spending on skin substitutes by roughly 90% without compromising patient care. That's a meaningful impact on the 2026 premium. Now let's broaden the conversation and look at what's coming in 2026. Based on a recent AARP article, 7 changes coming to Medicare in 2026. One of the biggest changes is the introduction of Medicare negotiated drug prices. Beginning in January, 10 high-cost prescription drugs will be available at significantly reduced prices. These drugs include medications for arthritis, blood clots, cancer, and diabetes, which are conditions that affect millions of older Americans. The ability to negotiate prices was made possible under a 2022 prescription drug law, and it's expected to reduce beneficiaries' out-of-pocket spending by $1.5 billion in 2026 alone. If these lower prices had been in effect in 2023, Medicare would have saved about $6 billion. Another important change involves the Medicare Plan Finder tool. CMS has added information about which doctors and healthcare providers are included in Medicare Advantage plan networks. This means beneficiaries can now check whether their preferred physicians participate in a plan directly within the tool, a major convenience compared to past years. Not all provider information is available yet, but CMS will continue to update it. There's also a special enrollment opportunity unique to 2026. If someone uses the Plan Finder during their first 3 months on a new Medicare Advantage plan and later discovers that the provider information was inaccurate, that their doctors are not actually in the network, they'll be eligible for a one-time opportunity to switch to another plan or return to original Medicare. Part D prescription drug costs are also changing. The out-of-pocket cap introduced in 2025 will rise from $2,000 to $2,100 in 2026. The maximum Part D deductible will increase as well, from $590 to $615. Some plans may offer lower deductibles, but these adjustments highlight the importance of reviewing plan options each year. Next, the Medicare Prescription Payment Plan, which was introduced in 2025, will become easier to use. This program allows beneficiaries to spread large prescription bills across monthly installments rather than paying everything upfront at the pharmacy. In 2026, individuals who participated in the program during 2025 will be automatically re-enrolled unless they opt out or switch plans. CMS notes that this automatic renewal will help reduce burdens for both participants and plan sponsors. Another major development is a new prior authorization test in Original Medicare. This 6-year pilot project begins January 1st and could eventually involve up to 6.4 million beneficiaries across parts of 6 states. The goal is to speed up coverage decisions and reduce improper spending on certain procedures and devices. While prior authorization has long been used in Medicare Advantage, this pilot marks one of the first times it may appear in Original Medicare. The proposal has raised concerns from the American Medical Association and consumer advocates who worry about delays or denials of care. Lastly, a long-running demonstration project, the Medicare Advantage Value-Based Insurance Design Model, will end on January 1st. This program allowed participating plans to offer supplemental benefits such as reduced drug costs, food assistance, transportation to medical appointments, and support managing chronic conditions. More than 7 million Medicare Advantage enrollees, mostly low-income or chronically ill individuals, may lose access to these benefits when the pilot ends, largely because the program proved too costly at more than $2 billion per year. And finally, CMS is tightening the rules around special supplemental benefits for the chronically ill. Beginning in 2026, Medicare Advantage plans will be prohibited from offering certain non-medical benefits, such as alcohol, cannabis, and tobacco products, cosmetic procedures, funeral planning, life insurance, and unhealthy foods. With all these changes coming in 2026, it's more important than ever to review your Medicare coverage during open enrollment, evaluate your options carefully, and make sure your financial strategy is prepared for rising healthcare costs. If you have any questions about your retirement magic number, your retirement strategy, or any other parts of your financial strategy, visit my website at mnawealth.com or call my office at 866-973-3627 to discuss how my team might be able to answer your questions and address your concerns. It's our goal to help you prepare for the retirement you've worked so hard for.
Disclosure: all matters discussed during the show are for informational purposes only. Opinions expressed are solely those of M&A Wealth and staff. All topics covered are believed to be from reliable sources. However, M&A Wealth makes no representations as to its accuracy or completeness. This commercial shall in no way be construed as a solicitation to sell securities or advisory services to residents where permitted. Topics should be discussed with your individual advisor prior to implementation. Advisory services offered through M&A Wealth, a registered investment advisor in the state of Texas. Insurance products and services are offered through PNC Life Insurance Agency, an affiliated company. M&A Wealth and PNC Life Insurance Agency are not affiliated with or endorsed by the Social Security Administration or any government agency.